Good morning, everybody. I am very pleased to have an interview with, I should say, the famous Benedetta Allegranzi from the WHO. I'm Margreet C from Rotterdam, the Netherlands, and I'm a professor in infection prevention. And I am pleased to introduce Benedetta as a joint professor in Geneva. And she now works at WHO since 40 years, and she is the technical lead of the work on infection prevention and control, as her focus is on the prevention of healthcare associated infections. And of course, this is a quite important topic now. And since February 2020, so from the early beginning, she co-leads the infection prevention control pillar of the WHO response on the COVID pandemic. So already many documents has passed and are updated and released and will come in the near future. And in the next 30 minutes, I will ask her some questions about that. And we will focus on the PPE, so the personal protective equipment use during this pandemic. And we will split it into the use for the healthcare facilities, healthcare centers, and into the community. So, Benedetta, I already asked you in the introduction, you must be quite tired. This is a lot of work. You did a lot of hard work. And there are many documents which are very easy and very convenient for us to use. And I want to start with just general basic questions about the elements on which your guidance are built. What is in recommendation of using a PPE? Can you elaborate on that?
Thank you, Margreet. And good morning, good afternoon, good evening, everybody online. Yes, so we have produced many documents, as you know, mainly regarding the management of patients, COVID patients in healthcare or home care and other settings from the infection prevention and control perspective. Some of these documents, in particular the mask document and also the rational use of PPE document, are being updated at the moment, and we are almost done with these updates. And indeed, the most important element for us to build upon while developing recommendations is really to build upon evidence. The main evidence that we consider in this case regarding PPE is the evidence on how the virus transmits, and also the evidence on effectiveness of specific PPE elements to prevent transmission of COVID-19 and or other coronaviruses or other respiratory viruses such as influenza, because as you know, the evidence currently available for COVID-19 is still scarce in these regards. We also consider previous recommendations available from WHO, for instance, for healthcare, those on IPC for epidemic and pandemic prone acute respiratory infections. And then we make considerations on implementation. So it's very important to consider how feasible is to implement these potential recommendations. It's important to consider potential harms also, for instance, of specific PPE, or availability and equity of access to PPE around the world. And also, obviously, values and preferences by the users. So there are many aspects to be considered.
So when I hear you, also the impact of your advices is quite important. And also we will come back to this, of course, when concerning shortage. But now I have one more detail to the questions about advising PPE, taking into account the shortage of evidence, of course, but we know more now how the virus transmits. So can you elaborate on the situation during healthcare where aerosols are generated and the recommendations the WHO has made to prevent transmission in that particular situation?
Okay. As you said, we learn more and more from different studies and also from different disciplines contributing to this debate, which is very important. It's clear now that there is a combination of possible different modes rather than, you know, separate routes of transmission.
Yeah.
But to the best of our understanding and the available evidence, what we know is that the virus is primarily spread through contact and through respiratory droplets. We know that under some specific circumstances, airborne transmission may occur. So one example is aerosol generating procedures, such as intubation, mechanical ventilation, and others that are undertaken in healthcare settings. And there is some evidence on possible aerosol transmission in, for instance, crowded, poorly ventilated settings in presence of infected persons over a prolonged time period. Also outside healthcare settings, in particular in, as I said, crowded and poorly ventilated settings. There are reports, as you know, from restaurants, from gyms or chore practice, etc. So going back to your question about what PPE are recommended in healthcare facilities. So PPE recommended primarily in healthcare facilities are those that belong to contact and droplet precautions. So medical masks, gloves, gowns, and eye protection primarily. But of course, in settings where aerosol generating procedures are performed, are ongoing.
Yeah.
So, and also when performing surgical procedures on suspected or confirmed COVID-19 patients, especially if there are procedures that are likely to generate aerosol. In these cases, certainly respirators are strongly recommended instead of the medical mask.
Yeah, but to summarize, the respirators, so the FFP2 and mask, are dedicated for special situations during care in healthcare, but you are not advising this in the community.
Of course.
Yeah. Okay. That's
they should be avoided in the community.
Yeah.
And they should be limited to healthcare.
Exactly. As
you know, there has been a long debate about the use of respirators in all situations, also in healthcare. We have carefully evaluated the evidence, including also recently, we have a very recent update of a Cochrane review on the effectiveness of medical masks versus respirators in respiratory infections, with new trials added. And so far, there is no advantage or reduced risk by using respirators in these conditions compared to medical masks, and also, as I said, by basing the knowledge on modes of transmission, we know that the virus is predominantly transmitted by droplets. So
yeah, exactly. So to summarize it, it's only for special indication there is a place to use respirators, and all other situations during healthcare are the medical masks.
Yeah.
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 And you also mentioned, of course, the route of transmission by contact. Also, that's difficult to know the contribution, but we know it exists, that the contact route plays a role in COVID transmission. And so we prevent that by using gowns. And of course, we know all that there are quality levels of GOMS, level 2 and level 3 for the people more known with that. But in short, the level 3 are not very comfortable to use because they are very fluid resistant. So it's hot and warm to work in that. And I think maybe you have some news from the WHO which GON will be advised in the near future to use during the care for COVID patients.
Mm-hmm. Okay, so in our current guideline, according to experts' consensus, because I want to really highlight that our guidance is produced based upon expert consensus, and we have a multidisciplinary group of more than 30 experts really formally providing advice through specific methodological processes to WHO on these recommendations. And I would take also the opportunity to thank all these experts for their incredible support. But I wanted to say, according to the WHO recommendations until now, we have eventually decided for recommending simple long-sleeved gowns for routine procedures and fluid-resistant gowns for procedures that are expected to produce a large amount of fluid that might penetrate the gown.
Yeah, like trauma.
But if not available, obviously in these situations, we also recommend to use a normal gown with a waterproof apron on the top of it. Now, we have been discussing this also very recently with a specific group of experts who are dedicated to PPE specifications. And there is some current debate about potentially moving to fluid-resistant gowns, especially, as I said, in particular, in targeted scenarios with risk of splash or high exposure to body fluids, which may contaminate the uniform. Also including, for instance, cleaning or aerosol generating procedures. However, the tendency is, regarding the specifications for these gowns, is to recommend in the disease commodity package level 2 gowns. You may know there are 4 levels of protection.
Yeah.
And the barrier protection of these gowns would be based on a low water resistant level.
Yeah, and more comfort.
And probably...
Because it's always balancing between the comfort, the availability, and the protection, of course, you need.
Certainly.
So now I want to skip more because this was all about taking care for COVID patients. But of course, we have the non-COVID patient, the routine care, and we will try in the next months to have as much as possible of the non-COVID care. But then, of course, the possibility arises that non-COVID care can be infectious to the healthcare worker. And that's also a balancing between doing the normal care as you usually did, so without any extra PPE, so just general precautions. So what is the standpoint of the WHO about taking care for these patients in the light of the prevalence of of COVID in the community, because that also predicts the possibility or the probability of non-COVID care being infectious to the healthcare workers without any protection at that time.
Mm-hmm.
Yeah.
Okay, so I think the WHO has clear recommendations. In general, I think the debate about asymptomatic patients or asymptomatic infections is, as you know, very lively. I think it's, however, very important to distinguish the prevalence of asymptomatic infected persons and their ability to transmit.
Okay, yeah. Because these are two different,
very different stories. So there are different studies or even systematic reviews saying that The range of asymptomatic cases is between 6 and 40%, more or less. There is a Chinese study establishing that this proportion is 23%. But then there are studies from different countries, but also reports to WHO from member states about transmission. So the transmission actually by these people seems to be between 0 and 2%.
Exactly,
towards others.
So this is a very important to mention, because the chance of being affected by an asymptomatic person or a patient during routine care is very, very low. And we must be very careful to not overdoing in preventive measures for this group of patients. Do you agree with that?
I think so. I think that we need to be cautious, but also really to look at each element of the evidence and be very specific, because otherwise, if we remain generic, really some statements that are made about the importance of this in some cases are really a bit overkilling, in my opinion, but still, we need to be cautious. So
yeah, to my idea, this is one of the main questions we will face in the next months. And I can give you an example how we deal with that up until now in the Netherlands. There we start with the health check on admission or on the outpatient clinic. And we also generate a 1.5 meter distance. And we have general precautions. And then we decided not to use any extra masking. And far away is the universal masking for this group of patients. So we developed also a guidance on, so when do you have to use a mask? And it's only when you're very nearby, so within 30 centimeters is very nearby, for more than 3 minutes. Then we use a medical mask, and only in that case. And of course, when aerosol generating procedure is something different.
Of course.
So this is the way we deal with that. Is this something also to take with in the WHO, that you have other measures which you first have to introduce, and only when you are not able to do that, then masks come at the last?
Mm-hmm. I think for sure we continue to insist that it's a comprehensive package of measures, both in healthcare and in non-healthcare settings. And therefore PPE and masks in particular are one element of a very important package that is comprehensive. And as you know, part of the package, of course, there is hand hygiene, very importantly, and also respiratory hygiene, and also environmental cleaning. These are key measures in addition to obviously the physical distancing that we mentioned many times, and it's in all guidance. Regarding healthcare, however, we have looked at the evidence, which is still very limited. But as you know, in our guidance, in healthcare facilities, in community transmission areas, in particular in high intensity community transmission areas, WHO advises that health workers and caregivers working in clinical areas in particular, regardless whether there are COVID patients or not, should continuously wear a medical mask during routine activities throughout their shift. And of course, in areas where aerosol generating procedures are performed, they should replace the medical mask with a respirator.
But your remark before that, the continuous use of masks during normal care, that's a quite important one, because this asks for many masks, so the high use is not comfortable. It is, well, deaf people are confused about that. And it's, yeah, you ask a lot for a shift of 8 hours to work with that. So that must be in the light of the risk. and we already addressed the risk with the chance of transmission from asymptomatic persons, because we are now talking about asymptomatic persons. So what about that risk? How to address that? How can you calculate? Because community transmission is something, well, I say, well, is this only in the region? Is for a timely period? So what is your idea about that? It's because the implementation and the impact are quite huge.
So sorry for asking a clarification. So you mean in healthcare or in the
in healthcare,
Yeah, no, I fully understand. So as you know, we warn about a number of disadvantages or problems in implementation of these recommendations. So clearly, there is emerging evidence about adverse events of continuous use of masks and respirators, in particular dermatological effects, but also discomfort, other symptoms by health workers and also non-health workers, such as nausea or
but sorry to interrupt you. It was about the recommendation about the continuous use of masks during healthcare in a situation when there is a considerable number of community transmission. So, but that's the difficulty, because when should you, what do you advise? When should you, that is the turning point that you say now healthcare must be delivered with continuous using mask by the healthcare worker. That's a turning point, of course.
There are many factors to be considered, and it's really a local decision to be made. But what I can tell you is that WHO is also currently reviewing the definitions of community transmission, and we are going to issue most likely an approach which really identifies different levels of community transmission.
Yeah. I think that's really needed before every hospital decides we have a local community transmission, and now we are going to wear for every patient's PPE mask.
So I think to answer your question, it's really about the intensity of transmission. It's about the resources available and the local perception and situation, because there are many settings where health workers request this approach because they feel more protected and comfortable, and other places where they consider the disadvantages as being too exceeding the advantages. So I think, you know, there is no size fits all, and I think it needs a really careful evaluation.
Yeah, thank you. So also due to time, I want to go to the community-related PPE. You released a guidance on the use of masks, and in this guidance you stated very clear, wearing a medical mask is only one of the prevention measures. It cannot be a standalone. So that's a very important message. And there's also currently no evidence that wearing a mask, either medical or cloth or fabric mask, in the wider community prevent them from infection. But there are situations you, as WHO, recommend to wear masks. So can you elaborate on that and what makes the decision to do it, not to do?
Okay. So again, we assess the evidence very carefully. As you may know, there are different pieces of evidence. And what is clear is that wearing masks may protect when there is an infected symptomatic person, for instance, in the household. And so there are studies about influenza-like illness and human coronaviruses in the households of patients affected by these infections, where there is limited evidence that healthy individuals could benefit from wearing masks. Also, the recent meta-analysis of these studies, especially those on beta coronaviruses, established that using masks, either surgical or reusable, is protective. Regarding COVID-19, there is a recent case control study from Thailand that suggested that mask wearing, in addition to hand washing and social distance, were all factors independently associated with lower risk of COVID infection.
Yeah. And again, I want to give an example how we up until now managed this in the Netherlands. If you are not able to do a health check and there is no distancing possible and no other barriers are possible, then masks are considered. And so we came up in the Netherlands with the public transport as the only situation, because in the restaurants you can do a health check, you are seated, also in the concerts hall, in the movies, etc. So there is a possibility to do something else. So for the Netherlands, the wearing mask comes into the end of all other measures. What do you think of that? Is this a good approach, or do you say, well,
no, of course,
end?
Yeah, absolutely. So as you know, WHO has a risk-based approach, which is very similar to what you described in real life. Yeah. So we encourage people to wear masks in situations where there is community transmission, and other preventive measures such as physical distancing, importantly, are not possible. But again, we emphasize the fact that this is part of a comprehensive package of preventive measures, which include other measures which I previously mentioned. Also, the other category for whom we recommend the masks in the community are vulnerable people. So for instance, again, when there is a community transmission, and in particular when physical distancing cannot be achieved, for vulnerable people such as elderly people over 60 or people with underlying comorbidities, we recommend using medical masks.
And also you just say now medical mask, and that brings me to our last subject. What do you think about homemade mask, the fabric, the cloth mask? Is there any place for that for wearing in the community?
Yes, of course. So again, we have done a lot of work on working with manufacturers and with researchers to assess the filtration efficiency of different types of masks. So we also gave some instructions to produce masks at home, actually also tested it with some colleagues and also around the world. So the point is that, yes, this can be done, but it's really important to see the features of this mask. First of all, the mask needs to be able to cover the face and to cover the nose, cheeks and chin. And the edges must be really close to the face. Also, we saw that it's important to have multiple layers and also specific type of materials. So far, what has been established by researchers working with us is that a minimum of 3 layers is required, and you possibly have to have an inner layer that is hydrophilic or water absorbing and easily breathable. Usually it's cotton. An outer layer that possibly should be water resistant. Can be polyester or polypropylene.
But this still sounds quite complicated to make it yourself at home. So what is this an answer on the maybe coming the shortage of masks?
The point is no. What I can tell you is for sure that these materials can be found on the normal market.
Okay.
And of course, it requires an effort. to retrieve the materials, but then making the 3 layers shouldn't be particularly difficult. So far, what we know, and we shouldn't hide this, is that the filtration efficiency of a mask, for instance, simply made of cotton, even if you have up to 4 layers, has only 13% of filtration efficiency compared to others, those that I mentioned earlier with different type of materials, which can achieve up to 70% filtration. And this is important. So I think that if we really want to achieve protection, we need to look at data and instruct people to do things in the best way possible.
Yeah, I think to end up, because we are in time now, I think that we need a recipe, especially for the public, especially when they are going to use this in the community to prevent the immunocompromised and other compromised people. And especially because maybe we will face in some countries or many countries shortage of PPE. So we must be very careful to either prevent ourselves and not to overuse. And that's the balance. And WHO helps us to keep this balance all over the world and to prevent the people in the community, but also to prevent infections in the healthcare and during healthcare.
Absolutely. I want to remark also that we have a number of videos to instruct people, one in particular to instruct people how to make these masks.
And great.
It's relatively simple. So
I think we have to end this. There's a lot of instructions and documents and keeping updated by the WHO. So please have a view on the website of the WHO. And Benedetta, I want to thank you very much for your interview, really. And your answering my questions. And well, keep strong, I should say.
Yeah, thank you so much to you, and I really appreciated also your views from the local perspective, having to deal with this in your country and to decide on guidance at the national level. It's really interesting to hear from your perspective for us to understand different aspects. So many thanks. And also I would like to tell our colleagues online that in 10 minutes or so, there will be a follow-up session, a live session again, where I can continue to answer questions on PPE use, and I'm happy to discuss more aspects.
Thank you very much. We meet each other. Thank you. Bye-bye.
Bye-bye. Bye-bye.